Hi everybody, Dr. James Morgan here for the health of it. Today we're going to be talking about the use and the need of antibiotics because, well, 'tis the season. We are now entering flu season where your chances of getting sick have now increased. Now, let me make sure this is clear. Antibiotics do not, I repeat, do not work for the most common cold or flu because, well, those are both viruses. Antibiotics are only good for bacterial infections. Now, bacterial and viral infections both potentially elicit the same type of symptoms. So try these things out first. Rest. Try to rest because your body needs to rejuvenate. Increase your fluids. Doesn't matter whether it's bacterial or viral, increase your fluids. We're going to try to flush your system out. Make sure you have frequent hand washing because, ladies and gentlemen, believe it or not, washing your hands frequently is the #1 way to prevent the spread of disease. Now, the other thing too is to treat your symptoms. So if you have a fever, do cooling measures such as tepid baths or showers. Increasing your fluids, believe it or not. You can use Tylenol, ibuprofen, both over the counter, so just make sure you talk to your provider before you start any of those things. Sore throats. Ice cream, hot tea, honey, throat lozenges. If you start getting a cough, you can use a humidifier at night if you need to. Now, just because if you're producing, different color sputum or spit doesn't necessarily mean that you have a bacterial infection. So making sure that you do symptomatic care, and remember, the best treatment for all of this is time. Allow your body's natural immune system to go to work. Now, if you get an antibiotic unnecessarily, I have a lot of people that do come in demanding antibiotics because that's what WebMD told them based on their symptoms, especially with kids. So just remember, now that we know all this stuff, antibiotics given unnecessarily will not help a virus. Time and symptomatic care will. But unnecessary antibiotic prescriptions only lead to potentially fatal diseases and resistance to antibiotics when you truly need it. Enter MRSA, or MRSA, as just an example. So talk to your primary care provider about what you should do with your symptoms based on your past medical history. Just because you have a runny nose does not mean that you have the West Nile virus, so just keep that in mind, okay? And also flu vaccines. They're recommended for the very young, the very old, and for those that are actually potentially around a lot of people that may get sick, such as healthcare providers. So just make sure you talk to your provider about it. Ask all the questions you need because we want to make sure that you're making the best decision for you given all of the information. So that's it for today. Make sure that you sign up for the mailing list. You'll get tons of, not tons because I don't like to spam people, but just the important things about news, updates, tips and tricks, things like that. So I'm Dr. James Morgan for the health of it.